Hello, folks. Hope you're all doing great. So, today let's talk about living with sciatic. Sciatic is basically a nerve condition, which sciatica is actually the name of a nerve which runs across your right hip towards your right thigh and right calf muscles and to your right feet. So, it is the largest nerve in the body, and what causes sciatic pain is that sometimes if you have got any injury on your back, or you have some disc prolapse, or your muscles at the back are said to be weak, so that causes actually sciatic. It actually sciatic is basically, see, I don't know. Yeah, it's like this is the muscle, and basically the sciatic nerve goes through the muscle. Okay, so like these two muscles. All right. Yeah. So when actually your muscles means they contract and expand, basically it is stressing a lot. So that is where it goes and pinches the sciatic nerve, and that creates a kind of shock sensation towards your that's what hip region, the behind the right thigh region, behind your right calf muscles. So that is actually really it's so discomfort. Actually, it just, it's like a shock. It's like a shock wave that goes like that. Suddenly it happens. You won't sometimes, you won't even feel that pain in your back, but actually you able to experience the sciatic pain. So that is basically what is sciatica. For me, yes, I am actually going through sciatic pain. Yes, it started about 2 years ago. I was actually, we were a family. We had gone to a pilgrimage trip, and actually I was sitting in the middle of the car, and it was a rocky mountain drive, so you can understand. So sitting in the middle of the car, actually you don't have support towards your back, either this side or that side. Middle of the seat, I meant. Okay. Yeah. So what happened, it was like, as it takes the turns around the mountains, you wobble from here to there, and like that. So I didn't have that I what do you say, that knowledge that I need to sit stiff and I need to not wobble here and there, and I need to have a support of my back. I didn't have knowledge. I just went with the wobble. It was a lot of shaking and discomfort, too much of movement of the back, and that is and we I took a break in the middle actually. uh, I just got down from the car, and just it hit it hit me like a lightning. That was my first sciatic experience. And actually, yes, it has been occurring like sometimes 3 times a year, like 4 times a year. First year it was not that much actually, yes, and the second year it actually it's too much. If I It occurs very frequently, and as usual, like doctors, if you go to doctors, they give painkiller prescription. They'll give you some tablets, like yeah, for the nerve pain and all, they may give you tablet. But frankly, in my experience, I have not got a permanent solution of sciatic. Even today, if I stress myself, if I do a lot of work or something, and I'm just moving around the entire day, or I bend down and I lift or move or push some heavy object, I can really feel the stress in that nerve there. And if it is too bad, I have to take a painkiller. I have no go. So frankly, these tablets have not been as a permanent solution. Frankly, to me, if it has happened to you, please let me know about it. And yes, so this is the starting of the sciatic journey for me. That is when basically once you go to the doctor, they will start telling you to take painkillers like 5 days. They may give even tablets for you for 60 days, for 3 months, for your nerve issues. There are certain tablets for your so yes, for your tablets also, for your nerve pain also they give you tablets. So basically, uh, yes, I think painkiller is just a temporary relief, but I haven't even found a permanent relief for sciatic as of now, to tell you. I actually saw a difference in the frequency of sciatic pain occurrence. Like once I started to reduce some weight, I almost came down to 7 kilos. I came down of 7 kilos, and I had seen a drastic, what do you say, improvement in the pain of my sciatic, And one more solution is I felt is that walking. Yes, it is not brisk walking. It is not like continuous, very hardcore walking. It's like how much you can do. You do it. It's okay. First day start with like 5 minutes. It's okay. Second day start with like 10 minutes. Just move on. If you can increase 5 more minutes the second day, and the third day start like with 15 minutes. So basically even 2 minutes it's okay, no issues, but try to increase even a minute or so forward, how much ever you can. And it may take 1 month, 2 months to do even 30 minutes of walk, or even 3 months, we don't know. But what I would recommend is that slowly take it step by step, minute by minute forward, increase the time of your walking. And it need not be brisk walking, as I said. You just walk normally, just walk how much comfort level you feel. That's it, that's more than enough. And just keep doing this, just keep doing it every day. See, what I would say is, don't miss one day, until unless you have really suffering with the pain. If the pain has shot up due to some strenuous activity, or by any means, you stop that day. Do not walk when you have pain. That is what I feel. So do not walk at all, even though you miss a week, no problem, but don't walk when you have the pain. Do not stress your nerve, because if you sciatic, basically, I don't know, there's a permanent solution, but you cannot damage that nerve more and more, thinking, negligently, because it is actually a nerve, and nerve damages can cause serious damages to the brain and other parts of the body. So please be careful when you have this condition. So please don't take it very lightly. So what I would recommend, as I said, walk, and as you start walking, I frankly, you would see the improvement. Okay, but just because you're walking, don't think that you can again lift heavy objects, or push something heavy like sofa or something, or pull anything heavy like a cupboard or anything. And do not bend down. Okay, if you need to pick up an object from the ground, please do a squat kind of thing, but do not bend your back. Okay, kind of squat, how much ever possible, try to do a kind of squat like thing. And then only, if you picking up the things, do not bend your back by any means. Okay, and while lying on the bed or moving on the bed, do not move it quickly. Take it slowly. Everything needs to be conscious. Okay, you cannot do it like ekdam, let me do it, I'm feeling fine today there's no pain, I will do this, I'll do that. No, sciatic condition takes almost 3 to 4, 5, 6 months. If you do it that devotionally, dedicatedly, that walking and taking care of your pace, it will definitely go away soon. It depends from person to person, but what I would say is, please do not push yourself too much. All right, so it depends from person to person. So see, so many people you can hear telling, yeah, I did this, I did that, my sciatic got what do you say, healed, why is it not working for you? I always, you guys, again and again, please don't take people's opinions. You are unique, you're different, they are different. Something would have worked for them, something would work for you. But just because someone told you anything, don't feel why it didn't happen to me, why it didn't. Do not compare yourself with anyone. You are special by your own, okay? Do not take people's words. Be your own advisor, be your own motivator, be your own everything for that reason, okay? So, as I said, it depends from person to person how the sciatic heals and how much chronic the condition is actually. So, if you are at the initial stage of sciatica, please take care of yourselves and go at slow pace. That is what I would like to say. And yes, also yes, people who do not have any choice, they have some physical activities in their day-to-day routine. So for to such people I would say, take one at a time and do not rush into things, okay? Like, see, take a break. Obviously if you're cooking something in the kitchen, what happens is that, like uh, yes, we don't know, we are like standing for 1 hour and 2 hours, like taking, cleaning the vegetables, cooking and all those things. But that is what I said, you need to be conscious, okay? I think I stood for 15 minutes continuously. Let me take a break. Just go somewhere, sit down for some time, relax yourself, okay? And then for 10-15 minutes, and then start your work. Maybe your productivity will not be as like it was before, but at least you can do it. So, what I'm saying, even though you have no choice, but you need to do it. This is the way to do it, okay? Do not push yourself, do not this thing. See, if God, I would say that if God has given you this condition, then He would even give that excuse for the thing that you are not able to do as before. All right, for example, like you are at home and you need to do like 10 chapatis in 1 hour, on in like 15 minutes. No, before you may have been doing it, but in this condition, if you have to do, then it will take 45 minutes or 30 minutes. All right, so it's okay. It's okay if people judge you. It's okay if you're not able to meet the time requirement. But ultimately, remember, it's about you. You need to see your pace, you need to see your comfort level, because when you're in pain, no one will come. So you need not bother about people's comments. You guys know what I'm saying. So that's what I'm saying. So take it a slow pace. And for me, actually, putting on weight was number one, which was really bad. And the second thing is that I used to feel frustrated initially. Why am I not able to do this fastly? Why am I not able to do that? So that made the situation more worse. So do not, that's what I said, do not push yourself for that. So these two things do not do for sure. The things that you require to do, as of my knowledge, is do a normal walking at your own pace. And if you don't have the pain, please do it every day, no issues. And frankly, if you feel little discomfort, stop it, as I said. And if you have pain, do not do walking on that particular day. Take some rest. It's okay. It's not too late to begin anytime, okay? Maybe you have done walking for a week and suddenly you got the pain on the 8th day, then you have to take a break for 1 week. It's okay, start again back on after the week. So do not get disheartened, do not give up, because if you give up, the pain will take over you for sure. Yeah. So the things, that is what. So if you are overweight, please think about putting down your weight, because putting down some weight really helps with the sciatic pain. And yes, the things to do is number one, walking at your own pace, at your own frequency, as I said. and be patient. So I think that has only worked for me, and as I said, the tablets were temporary solution, not a permanent solution. Okay, and do not do these things. Number one is, do not bend, do not lift heavy objects, do not push any heavy object, do not pull any heavy objects, or do not do anything strenuous with force or a jerk. Okay, and definitely do not do any brisk walking, forget about running so at that stage. And do not what do you say, make quick movements. So these are the things that you should not do when you have sciatic. So folks, so hope this talk has helped you guys in some knowledge, and whoever is in my condition, hope they also get well soon, because I understand the pain of sciatic. Because um, you know, as I said, do not take other people's advices. It would have worked for them, but it cannot work for you as well. It's not like it has to work for you also. It may have worked for them. And some people mistake back pain with sciatic, so both are completely different, but it is also related to the back in that way. So that is the only common thing. I know a person who got back pain, and they went to the doctor, and they came to me, see, the same thing I'm suffering, what you have suffered. The doctor says I should not bend. Do you think you can live this life without bending? Okay, fine. If you don't want to listen to the doctor and go and do the bending, and you'll only go and suffer. Okay, so such people, you cannot take their assumptions, because they think they are very like Superman, Superwoman, and they want to bend and do all the things. Let them do not change your perception because someone has told their view of something. See, a doctor, he's knowledgeable enough to tell you what is, how it is. So see, if that person doesn't want to listen, let them not influence you. If they influence also, please do not get influenced by them. So believe what works for you the best. Listen to your heart, your mind. Do not get diverted, do not get influenced. Please take care of yourself, because that person, yes, maybe it would have worked for that person, but it cannot be the same for you. If you think, yeah, I know, right, can we live life without bending or doing any work, and if you bend, you will sit on the bed for a week, and that person who has told you that will not be of any use or any help to you. So forget about that. So you need to trust yourself, trust your instincts, and believe yourself. Okay, so guys, fine. So hope this video has really given some like sunlight to the people who have been suffering through sciatic. So please do these small things, and it is a request, because I don't know, I'm not saying it has worked for me, it should work for you, but I think I have seen this. Many people have told, so doing normal walking will not hurt you for any means. Just normal walking, it's just like slow walking. That is called normal walking. Slow walk, slow pace walk. Okay? And yes, guys, so take care, and I'll see you next time with another useful video like this. Until then, bye.